incredibly fascinating. Love the way that we can use technology, spatial data and AI to help us to map out more clearly, to see how everything truly is interconnected to design better solutions at both national and global levels as well. Amazing, love that. And so now that we've heard a little bit about the role that new sources of data and artificial intelligence can play in fighting disease, let's dig into it a little bit more with our next panel. I'd like to welcome back to the stage Kelly Willis from Malaria No More, who is going to be moderating the panel Climate Readiness, Resilience and Response, AI for Disease Prediction and Planning. Welcome, Kelly.
Well, hello again, everyone. We're nearing the end of a very long day, so thank you to everyone who's hanging in there and staying with us. Is that my mic? Okay, I'll hope it. Well, I am excited and energized by that last solution spotlight and glad that we have an opportunity to continue conversation around artificial intelligence with 3 expert panelists that I will introduce momentarily. It's interesting in the global health space, I'm trying to reconcile in my mind the phrase infinite sources of data and with some of the more conventional surveillance data challenges that we struggle with on a day-to-day basis in most of our work. And I suspect that there is some solution emerging from this ever-increasing amount of data, everything from the kinds of commercial sources that Jim just told us about, to crowdsourced, open source, social media, satellite imagery, just this hugely expanding array of different types of data, at the same time as we have this rapidly increasing computing power to be able to make sense of that and turn that into information and intelligence that we can use in our work. So it's very energizing, so I'm looking forward to this conversation. I will introduce the panelists and then ask for your remarks. First, Professor Richard Maude is an infectious disease physician, professor of tropical medicine at the University of Oxford. He's based in Bangkok, where he leads the epidemiology department at Mahidol Oxford Tropical Medicine Research Unit. And he's working with ministries of health throughout Asia Pacific on these kinds of complex relationships between disease and climate, environment, human mobility. Professor Hammam Riza, on the end there, is a professor of AI at the University of Seoul Kuala. And he's also in the government as a position within a Ministry of Research and Technology in Indonesia as the CEO of the Agency for Assessment and Application of Technology. Love that. And prior to that, Professor Riza served for nearly a decade as the Chief Information Officer within the government in Indonesia. And then Dr. Hosni Ghedira is an expert also in AI. He has extensive experience in research, innovation, new technologies. His interests span everything from Earth observation and microclimate modeling, and he brings expertise in data analytics and is very experienced in applying climate modeling and forecasting to detection methods for malaria in particular, but across the board, really. So, Richard, let me turn to you first. Your background is you work a lot in disease modeling, and we've heard quite a bit about disease modeling and the opportunities that it affords. We heard from the Wellcome Trust earlier about the need for more investment in multiple areas of disease modeling so that we can better understand and articulate the scale of the problem, the scale of the impact that we're seeing climate change causing on different aspects of human health. But we've also talked about how disease models can be used locally as a tool, as a decision-making tool to health authorities to help make more cost-effective decisions and approaching disease elimination. So we'd love to hear about your work in Thailand and how artificial intelligence has or has not improved the efficacy of the disease models that you oversee.
Sure, thank you very much, and thank you for the question. So I lead a team of data scientists, health policy researchers, and also field researchers. They're based in lower and middle income countries across Southeast Asia. So our goal is to develop capacity in these countries to support ministries of health. So our main work is on analysis and modeling using infectious disease surveillance data, and then all the other data that goes along with that you've just heard about. So we're primarily focused on infectious diseases such as malaria, dengue, and COVID, which is where a lot of the interest lies from ministries of health, but as an entry point for health system strengthening. So there's three main types of modeling that we do that are generally used in infectious disease prediction. There's statistical modeling, there's mechanistic modeling, and there's machine learning, or AI. So each of them has its own advantages, and there's particular use cases for which they have strengths. In general, statistical and mechanistic models, they're much more widely used for disease prediction, and there's a wide variety of methods and techniques that have been developed for particular questions. For AI, I would say it's still in the relatively early days, but the usage is increasing very quickly, particularly in global health. So it's especially good for combining large, multi-dimensional data sets. That's very large, complex data sets, very large file sizes, and combining multiple data sets together in the same analysis in a way that the other methods can't do. It's also proven quite useful to simulate results from the other methods to rapidly generate results for a range of different scenarios. However, there's a problem of lack of transparency in understanding what the AI model is doing, and also in the generalizability beyond the data that's used to train it. So the availability of that data is crucial to build good AI models.
Thank you. Yes, so that's the black box phenomenon, really, the distrust that many people have with not understanding how the recommendations and results were achieved. I understand that. Could you say a little bit more about those multiple sources of data? Are any of those such like the ones that we just saw in this sort of seemingly futuristic display from Jim Golden? Are we seeing satellite imagery as well as on-the-ground sensors?
Yeah, so essential to it all is the disease surveillance data, which is on reported cases through different systems, usually managed by the Ministry of Health. But along with that, there's also, we see climate, which is from climate stations, and then from satellite remote sensing, there is this other large climate data set, which is accessible through websites in partnership with other organizations such as NASA or ESA. There's population distribution information, and there's been large models developed to try and map out where populations are across the world when that information isn't up to date. Population movement, so for example, using cell phone records or social media data, and also data on public health interventions where they've been implemented. So the data needs, it depends very much on the time scale of prediction, and there's a big focus on short-term predictions such as dengue outbreaks or dengue epidemics, and the accuracy of those predictions is always much better for short-term. The accuracy decreases for longer term, but the precision and the time over which that data is needed increases greatly for these short-term predictions.
I see, thank you. All right, moving to Dr. Hammam, please, Professor Hammam. You are also an expert in artificial intelligence, but what really jumps out for me in your bio and your CV is just the array of different sectors of the government and the economy that you're working in. You're not uniquely focused in the healthcare sector. One of the things we've heard about on a few panels already today is the importance of working across sectors, both private and public sector, but also different sectors of the economy, so not just health, but agriculture and education and urban planning, et cetera. But that's easier said than done, I know. So I'm hoping that as you tell us a little bit about your work, you can also touch on that in particular. How have you managed to create truly intersectoral collaboration among such a wide array of ministries and economic sectors?
Okay. Thank you, Kelly. Can I bring up the presentation?
Yes.
Just to elaborate more on my works. Okay. So, especially I would like to start with the national AI strategy in Indonesia, which we launched just during the pandemic in early 2020, which touch on 5 priority sectors. Firstly is healthcare. Second is bureaucratic reform, research and education, food security, as well as mobility and smart cities. So even though I'm not specializing in healthcare, but I would like to share with you some of the things that we brought up during this implementation of our national AI strategy. So I would be happy to address the unique challenges that arise in healthcare sectors and the challenges of adopting common solutions, such as tools for practical applications. I can certainly speak to the challenge of data sharing and intersectoral collaboration, as these are critical components of successful tools, adoptions, and implementations. In many government vertical sectors, especially healthcare, one of the primary challenges of adopting new tools and technology is ensuring that they are effective and useful in real-world setting, and this often requires collaborations between multiple stakeholders, including healthcare providers, researchers, patients, and policymakers. Based on our successful rollout of T4, we call this, maybe in my next slide, please. Testing, tracing, tracking, and treatment during the pandemic COVID-19, which I formed under the Ministry of Research and Technology, National Research and Innovation Agency, namely the Task Force for Research and Innovation on COVID-19. Data sharing is an essential part of this process, and it allows different parties to share information and work together to identify the most effective solution in this case. However, data sharing in healthcare, as been said earlier, is challenging to the concern around privacy and security, and healthcare data is often highly sensitive and subject to strict regulations, which can make it difficult to share across sectors or even within the same sector. So those challenges that we face during the COVID-19 actually drives that there should be a strong breaking the barriers to sharing of this data or collaborating across sectors, which can really enable the progress of the tool adoption and intersectoral collaboration in healthcare. And I want to put a special emphasis on this data sharing because it is crucial for effective disease surveillance and response, just like when we had this COVID-19 testing, tracing, and treatment solutions for COVID-19 were enabled by data sharing across all those vertical sectors in the government. And going into specific cases of data sharing on malaria, next slide, please. As we know, malaria is still a significant public health problem in Indonesia, especially in remote areas with poor access to healthcare services. However, with the advancement of technology and the implementation of the malaria surveillance information system, SISMAL for short, we in Indonesia can now collect and store valuable data to help us to forecast and prevent malaria outbreaks. SISMAL is a database that stores information on detected malaria cases, endemic surveys and monitoring, and other epidemiological data. The system collects and records various types of data, including demographic, geographic, case surveillance, interventions, and trend data. This data help us understand the distribution and dynamics of malaria in Indonesia, which is essential for planning and implementing effective malaria control programs. So if we are leaping forward for the precision public health, especially in controlling malaria, then we need all this data, whether it is geographic data in the province. Next slide, please. District and sub-districts informations. These informations help us understand the spatial distributions of malaria and identify areas with a high burden of the disease. So, in conclusions, this malaria surveillance information system needs to be leveraged with other data in order for us to apply artificial intelligence in the precision public health, and especially in predictive communicable disease, not only malaria, dengue, and TB. Tuberculosis is still considered as communicable disease by the Ministry of Health in Indonesia. So let us continue to support with the collaborations with all the stakeholders, and I'm especially honored to be part of the collaboration with Malaria No More into applying these predictive and planning toolkits in Indonesia. Thank you.
Thank you. No, we're very excited, Malaria No More and the Institute for Malaria and Climate Solutions, to be embarking on this mission with you, and great to see that we've got such a strong local partner who has navigated these issues. It strikes me that we set out to talk about artificial intelligence, and we find ourselves talking more about data sources, complexity of merging them, analysis, privacy issues, data sharing concerns, sensitivities. And Richard, you brought up capacity building as such an emphasis, and one can see easily how the application of these new technologies is really where a lot of the work will be, right? Hosni, as we turn to you, I suspect that's a nice place for you to start when talking about the Mohammed bin Zayed University for Artificial Intelligence. And what are the goals of the university? I'm not aware of too many universities exclusively focused on artificial intelligence. I know that what you're doing it extends to both research and capacity building and training. And so over to you to tell us some of the ways that you're demonstrating the possibilities of artificial intelligence and what it means to train a whole workforce to be able to navigate those complexities and apply AI for good.
Thank you. Thank you, Kelly. So yes, MBZI, it's a university graduate level focused only on artificial intelligence. We have 3 academic departments, like machine learning, computer vision, and NLP, natural language processing. And in our engagement with Malaria No More in the Indonesia project with Dr. Hammam, the 3 departments are involved. So the machine learning department in terms of processing data, as you have seen in the previous presentation, we're getting like 100 of gigabyte, terabyte of data per day from satellite sources, from ground station, from weather models, how we can merge all this data into one platform to benefit forecasting and near real-time forecasting and real-time as well assessment of situation, and providing data that can feed and can help decision makers for their day-to-day decision. So as I said, we are graduate level university now. We are about 400 scientists between graduate student, postdoctoral researcher, scientist, and faculty working on many, covering the whole spectrum of AI through those 3 academic departments. But at the same time, we have horizontal research center that feeds and support businesses, government entities, in converting scientific research into applied product, and the malaria project is one of them, by bringing all the set of expertise in the field and how we can support this malaria project. So just to give you a quick overview about our involvement in the Indonesia project. So we definitely, it's about the climate for the long term, to see how climate indicator are impacting or influencing some trends in malaria cases. And also we are integrating real-time satellite data in daily basis. We are using geostationary satellite to give real-time information about the weather condition, about the cloud coverage, about humidity, about precipitation, integrating some surface data, land cover information to estimate and predict where water will be accumulated and link it to mosquitoes activity that will lead to some outbreaks of malaria. And this model will be trained with long historical data, is why we rely on our collaborator in Indonesia to do the lobbying with the entity, with government, as Dr. Hammam mentioned, is not easy. It's very sensitive data sometimes, but we are doing our best, and we rely on our partner for data sourcing and data collection. And we have a team of scientists that can process the data and then use to train our algorithm. So the question where AI can evolve in this exercise is mainly the machine learning part, in the causality, in the casual discoveries, how we can link some weather parameter to some cases and some outbreaks, some spots of outbreak. And also we'll be integrating mobility data that is very critical, because most of cases outside of POAS are imported cases. So how we can integrate traffic data, can integrate like maritime transportation data into the prediction system. And this is in the near, so the idea is to have this dashboard that are fed with many sources of data from satellite, from weather models, from climate model, and can you decision maker to make decision about any action that is required to respond to any crisis.
Yes.
Thank you. So Hosni, I think what I'm hearing you say in part is that even the most sophisticated artificial intelligence, machine learning system requires training and requires those causal relationships to be explored and mapped, and that's a process. I imagine as we go into any new disease state or geography. Richard, I want to bring that back to you a little bit to talk a little bit more about that aspect of your work throughout the region. What is particular about that training, the machine learning specific to a particular geography and disease, and how do you go about that?
Yeah, thank you. Well, as you've heard, there's a lot of potentially complex data sets, and countries struggle with the management and use of that data, but also collection of some of the basic data that they need, like the locations of villages, health facilities, surveillance information. So both having limited resources and capacity as well as time to learn how to do this. Yeah. So we've come up with a different model. I wonder if we can have a slide. So because of this need, we get a lot of requests from countries for support. We do a lot of modeling and analysis, but some of this more basic support, training, one-on-one, long-term support. So today, we're announcing the launch of a new entity, which is called the Health GeoLab Hub. So you can see it on the slide here. So this is a regional resource run by my department. It's supporting countries in Asia and the Pacific with what's called the geo-enablement of the health information system. So that's bringing all of the data together around a common geography that can be managed locally in country, and also supporting them about how to get the most out of that data. So we're covering 3 areas: research, technical assistance, and training, capacity development. And we're following this geo-enablement framework, which is also adopted by the Global Fund. So you can see there's 9 different elements, but it includes extending out to policy buy-in, as well as having use cases and a lot of detail about how the data is collected and managed. So we're covering up to 32 countries. We're launching in 8, and the model is that we have staff on the ground that are part of the hub that work in partnership with the Ministry of Health in the long term.
Congratulations, this is very exciting, actually. Which 8 countries are the first?
So Bangladesh, Cambodia, Laos, Myanmar, Thailand, Vietnam, Indonesia, the Philippines.
Excellent, and we can learn more at your website.
There's a QR code there, and there's actually a website that's just been launched.
Excellent.
We're actually looking for support to expand, to increase the capacity of our country teams, and also to launch in other countries.
Well, it certainly seems like something that many of the folks here in the room will be interested in being involved with or being able to support in one other way or another. So that's great, wonderful. So again, a conversation with a relatively lay audience. Of course, we're not going to get into the actual, the AI. I don't even know how to give an example of what would be the specific conversation about the AI. So we're talking about the practical application. We're talking about rounding up of the data, training of the models, providing the training and capacity building to the partners to be able to use it, overcoming a lot of those natural sort of silos between different parts of a government and natural distrust both of the technology and of data coming from unknown and other sources. So these are obviously a wide array of sort of challenges. And yet, I think it's clear that the opportunity is very real, and things seem to be just changing so fast. So it seems almost every day we're hearing some new, exciting application for AI. I'd love to hear from each of you sort of where you think we'll be in 5 years' time, let's say. 5 years, I think, is almost an eternity in this space, so much could change. But give us an inspirational sort of vision of where you think things might, be from within the health sector and AI. Hammam.
Okay, all right. So, I want to talk about the healthy futures of Indonesia. Yeah, right. I will try to. I think James earlier have put down really amazing presentations on how we see data as the new gold or the new oil, they say. So we are looking at a new global health architecture, especially when we had the G20 in Indonesia last year. We've seen healthcare, energy transitions, and digitalizations as 3 pillars. And of course, if you go back to how AI or data-driven models can leverage the accuracy, then we are talking about emerging data sources. And we are seeing the futures of these emerging data sources. With the increasing availability of new data sources, just like have been shown by James earlier, AI algorithms can now be trained on a wide range of data beyond traditional healthcare records, such as social media, wearable devices, genomics data, and of course, environmental sensors. These emerging data sources that will, combine into millions of bytes, petabytes probably, has the potential to significantly improve the accuracy, the effectiveness of AI-driven model, especially in public health. That's why we call this term precision public health. And just like I've indicated earlier, take for example, the ubiquitous wearable devices, such as smartwatches and fitness trackers, now can collect a vast amount of data, health data, whether it is heart rate, sleep patterns, activity levels, and this data can be used to develop more accurate models, more precise models of disease risk and progression, as well as monitor patient remotely, for example. And we are also in Indonesia are looking very much into the genomic data. The rapid growth of genomic sequencing technology has led to an explosion of genomic data. We call this project is BGSI, is under the Ministry of Health, and can be used to identify genetic risk factors for diseases such as heart diseases and many other diseases. And certainly we need to come up with AI use cases, yeah, that can be trained on this data to develop more personalized treatments and also improves outcomes. So that's my take on the.
That's a good vision. So as soon as you bring genomics into the mix, it is very
Right.
aspirational and exciting, right? So, and I hear you saying both for the purpose of personalized medicine, but also for precision public health.
Public health.
And so, we've heard a couple times already about the capacity of AI and shared data sources to create more cost-effective allocation of resources and go farther with less in the context of disease elimination in particular. Very exciting. Over to you, Hosni. Where do you think we'll be 5 years from now with regards to AI and climate and health?
I think how I see it, and maybe a dream, is to have two scales at individual level. As Dr. Hammam mentioned, collect as much data as we can through sensing technology,
Right.
through like cameras, drone technology, combining how computer vision can be used to measure some parameter that cannot be measured today. Now there are some advances of some remote sensor that can measure heartbeats remotely, can capture some face pattern that can be linked to some diseases as well. And this is progressing because it requires a lot of computing resources as well. This is individual scale, but also the large scale. If we can manage to have this dashboard, like showing real-time data, showing some forecast data, and that can be used for decision maker to take action. We are, like Richard, we're working on an area, tropical areas, very complex area when we use remote sensing, because forested area, sometimes not easy to detect or to capture, for example, water accumulation under trees. Only when you use like active microwave data that is expensive now to implement it in real-time monitoring. There is no free active microwave data that can be used, but that's very efficient to detect water accumulation in forested landscape. Combining all this data, it will be like the dashboard will be the top of iceberg, but all the engines that are running in the background that compiling, collecting this terabyte of data from sensing, from Earth observation, from climate models, and having all those advanced algorithms that are trained with very high quality data as well to have the most accurate prediction. And this can help a decision maker, and as also it can go to the national scale and could go to individual scale as well. And all about data, as much data, as much quality data that we can collect for individual, like geolocated data as well. It can help in any all decision-making process.
It is very exciting to imagine, again, along the lines of the solution spotlight that we just saw, a truly global dashboard.
Yes.
With an ensemble model of all different data sources and the curation that would be involved in maintaining that, but then just, almost hard to imagine the degree of impact that could have from a resource allocation standpoint down to, individual decision support for healthcare workers in the field. Richard, what about you? What is your aspiration for the next few years in the AI field? What current challenges that we haven't talked about might it solve?
One of the big challenges that's already starting to change, actually, is the lowering of barriers to entry for use of AI and machine learning. So even 5 years ago, it was very difficult for people to come in fresh. And now there are tools, there's code, some online solutions. So even PhD students in their first year are starting to use it as a method. So that's an opportunity, but it's also a danger that it's less controlled. You get people coming in naively sometimes, results that may not be so informative. And a way forward through that is for this multi-sectoral collaboration that's already been mentioned. People that are close to and understand the data, they know about the methods, and then they also know about the policy landscape that they're trying to influence.
What do you think that looks like in terms of governance structures to orchestrate that internationally?
Yeah, it's an interesting question, and I think that problem hasn't been solved, but it's something that does need to be addressed. It hasn't been an issue so far with things like statistical tools because there haven't been similar, widely available, usable methods. But this is a new challenge we've got to deal with.
Yes. Great. I I don't have a time check, but I think we have time for a couple questions from the audience, if there are any. Questions for the panel?
Okay.
Hello. So my question is for Hammam. On your slide, I saw climate-induced malaria, and I'd like you to, talk about that climate-induced malaria. If there's anything that made you put that there, climate-induced malaria.
Well, can you bring up my presentation again, please? Especially on that slide that was asked. So the title, Climate-Induced Malaria, is to do justice to this communicable disease, right? As you know, the environment data is crucial. Environmental factor is crucial for the precision public health, and especially in order for us to control malaria transmissions. I would like to say a few things here, that by having AI algorithms that can play a key role in enabling this precision public health, by analyzing a large amount of data, especially the environmental factors coming from the climate-induced diseases and health outcomes. And of course, we need to identify patterns and correlations that can inform the development of more targeted intervention. Yeah. So some of these key enabling factors for this communicable disease such as malaria is how we can really integrate the climate-related events happening in the most, let's say, difficult area in Indonesia. For example, in Papua and in near East Timor, those areas are really vulnerable, and this is where we want to have a kind of predictive analysis that can be used to forecast the outcomes of the malaria information system based on the environmental and other health data. I hope this connects to and answer to your questions.
Hi everyone, Rumi Chinara, and New York University Director for Center for Health Data Science. Thank you so much for the great presentations. Given all the panel members' wealth of experience, in not only developing analytic models, AI, machine learning, but also using it in practice in the government and on the education side, what are your tips for also equipping students not only to develop models, but also to be equipped to ensure that they can work effectively, for the end user, and also on the converse side, equipping the recipient to also use data, driven models in an effective way. Given all we've seen about, how people use or don't use these things well, and reflecting on Felipe's presentation this morning, we'd love to hear from you on this topic also.
That's a great question, and I wonder, Hosni, if you want to take that from a sort of teaching perspective in the university setting.
Yeah, I think motivation of students is key, because when you are dealing with a computer scientist and then because the challenge I'm facing personally, because I am director of research engagement, so helping faculty to create this bridge between fundamental research and applied research. Because when you have scientists in university, I think Richard is one of those cases, for them fundamental publication, quality publication is the key, but how the general public can benefit from this research. And this is mainly the motivation of students. If we take the example of the malaria project that our machine learning students are involved in, so they took some courses in healthcare because they are pure like computer scientists in the modeling and the question how we can assure that the student after their graduation will continue working on those field of application and will benefit the public health community in this. So self-motivation is the key, but also to create the ecosystem to expose our students to real project. So we have students are excited to visit to Indonesia and see what happens. Some students are excited to fly drones with the combination of thermal camera, like hyperspectral cameras, and see if they can detect some indicator that can later on link to some malaria outbreaks and so on. So I think engaging students at the early stage is the key, and then give them the exposure as well. So we don't want them to stay in the lab developing their algorithms, and we want them to get engaged in events like this one, to interact with people that have ground experience in the field, and they can benefit and exchange, and they can use those interactions in tuning their scientific and their modeling work.
I think you'll have a chance to learn a little bit more about IMAC's malaria prediction and planning tool in a solution spotlight coming up. But one of the things that we took away as a key learning in developing that toolkit was the need to stay very connected with the ultimate end user, right? So keeping in mind the specific use cases of someone who's planning for long-term health workforce allocation, or planning supply chains for commodity procurement, or making decisions about the timing and location of key malaria interventions, for example. Sometimes we found that we had much more information than was actually going to be specifically used. And it was very important for our dashboard to reflect those specific use cases, so we can talk a little bit more about that tomorrow too. I think we have time for one more question. Oh, there's a question up here.
Thank you. Actually, my question is Dr. Hosni, and also earlier I learned that basically if we are using machine learning and direct climate model or weather forecast model, I think we may have some problem, because if you know the earlier question also, the temperature, the relationship is not like that linear. For temperature, malaria, there is some transmission window. It is not like that more temperature, that more increase of temperature will give more malaria. Just like some of the, because climate change is due to that, some areas, for India, suppose Uttarakhand, that area earlier, it was not malaria prone, but that transmission window, that it is being increased. So that more areas, though Orissa and some areas we have the decreasing, but some more area is coming due to that transmission window, that temperature, it is getting that transmission window. So instead of direct climate model output, we have to use that climate product, sector specific. For malaria, we have to. Another is humidity or temperature diurnal variation. We have seen some 10 years data that diurnal variation of temperature, it is less, diurnal variation means more humid. So it is directly related to this. There are some factors with limited data, we can generate that sector-specific climate product, and instead of using climate model in the machine learning, all directly weather model, climate model, it may have wrong result, and we will miss that relationship. Thank you.
No, the climate part of the research has two scale. The climate is the long term, so collecting data for the last 10 years, working very closely with BMKG, the National Meteorological Service of Indonesia, to collect the data, historical data, as long as we can, and then at the same time collecting a precise malaria occurrence data, geolocated data as well, because it's very important. And we are not there yet. We are at the stage of trying to collect all weather, climate data, and then try to see any linkage between geolocated malaria cases. So your question is regarding the data. As you said, we are collecting data at different resolution, time and space. We have data that we get each 10 minutes, each 1 minute. We have some data are monthly data. Other data, we are receiving data at very high spatial resolution, but other data is like emissivity data is like at kilometer scale resolution. So we are using the machine learning for the data fusion and advanced computer vision techniques to see how we can capture any causality, any pattern that can link. So this is a scientific part of the research. But I agree it's a complex problem to have this link between long-term climate data and very high resolution occurrences of malaria cases. We are using the weather station as well. So the weather station I give more accurate measurement. As you said, the temperature is one of them, humidity, surface temperature. Precipitation in Indonesia is very complex. It's raining almost every day. So even the most advanced weather forecasting model are not as precise as in other locations. So the precipitation definitely is the key parameter, but the landscape is the key. It's a static information merged with dynamic information. And we try to see how machine learning and our advanced machine learning expert can benefit, can help to have this linkage, to correlate weather-related and malaria-related conditions.
And I'm afraid we'll have to leave it at that, and I'm conscious that we barely scratched the surface of this topic, reassuring you all that it will be a recurring topic tomorrow, including some very specific examples of applications of AI for disease models. But I'm glad that we tackled some of the more systemic considerations in terms of data sources, capacity building, technical assistance, and some of the challenges. We'll come back to all of this and hope that you will all approach our panelists when you see them on our break, which I think is coming up, and we'll all continue this conversation. So help me thank our panelists for a great conversation.